Right now, somewhere in the United States, a cat is sitting quietly in the corner of a living room, purring softly, looking completely normal, while something inside its body is slowly falling apart. The owner has no idea, because cats don't cry out in pain the way dogs do. They don't limp dramatically or whimper for attention. Cats are masters of disguise. In the wild, showing weakness means becoming prey. And even after thousands of years living on our couches, that survival instinct never left them. This is exactly why so many cat parents find out something is wrong only when it's already an emergency. But not you, not after this video. Because today you're going to learn the 10 signs your cat is silently begging for help before it becomes a crisis you can't undo. The silent suffering most owners miss. The first sign most people overlook is a change in appetite. Not just refusing food completely, but eating slower, walking away after a few bites, or suddenly obsessing over food when they normally graze. Cats regulate hunger with incredible consistency, so any deviation is a message. The second sign is thirst. If your cat is drinking noticeably more, standing at the bowl longer, or you're refilling it constantly, this can point to kidney disease, diabetes, or thyroid problems, conditions that are manageable if caught early. The third sign is weight change. Even losing half a pound is significant for a small animal. Run your hands along their spine and ribs. If you can suddenly feel bones that used to be padded, or their belly looks swollen and firm, that's your cat telling you something is wrong long before it shows outwardly. Something's off with their body. The fourth sign lives in the litter box, and your cat's bathroom habits are one of the most honest indicators of their health. Straining to urinate, crying while doing it, blood in the urine, or repeated trips without much output can signal a urinary blockage, which, in male cats especially, can turn fatal within a day or two if untreated. Diarrhea or constipation lasting more than a day or two matters just as much. The fifth sign is their coat and grooming. A healthy cat is a meticulous groomer. When a cat stops grooming and their fur turns greasy or matted almost overnight, it usually means they feel too unwell to bother. Over-grooming to the point of bald patches or raw skin can point to allergies, pain, or anxiety. The sixth sign is their breathing. Watch their sides rise and fall while they rest. Rapid breathing, open mouth breathing, wheezing, or a persistent cough should never be waited out because respiratory distress in cats escalates fast. Behavior that should never be ignored. The seventh sign is hiding. Every cat enjoys a quiet nap. That's normal. But when a social cat suddenly disappears for hours, avoids interaction, and withdraws from the family, that's one of the clearest distress signals in the feline world, because cats hide when vulnerability feels dangerous. The eighth sign is a change in vocalization. A quiet cat that suddenly starts yowling, especially at night, could be dealing with hyperthyroidism, cognitive decline, or pain. A chatty cat going silent is just as concerning. The direction of change matters more than the behavior itself. The ninth sign is mobility. Watch how your cat jumps, walks, and climbs. Hesitating before a jump they used to make easily, stiffness after waking, limping, or avoiding stairs can indicate arthritis, injury, or neurological issues, because cats compensate for pain so well that hesitation is often the only early clue you get. The warning signs vets wish you knew sooner. The 10th and most overlooked sign is a change in your cat's eyes and gums. Cloudy eyes, unequal pupil size, discharge, or a third eyelid that stays visible are signs vets take seriously. Pale white or yellowish gums instead of healthy pink can indicate anemia. Liver problems or jaundice, something you can check at home in seconds by gently lifting your cat's lip. Veterinarians consistently say the same thing. Cats don't fake being fine, they hide being unwell until they physically can't anymore. Waiting for dramatic, obvious symptoms before a vet visit is one of the most common and heartbreaking mistakes cat owners make. Early intervention isn't just about saving money on emergency bills, it's about giving your cat the best chance at a long, comfortable life. The subtle stuff, the stuff that seems like nothing, is exactly where prevention lies. When it's an emergency, not every sign means panic mode, but some demand immediate emergency care, no waiting, no monitoring overnight. If your cat is straining to urinate with no output, struggling to breathe, vomiting repeatedly, suddenly weak or collapsed, has a swollen, painful abdomen, or cries out when touched, get to an emergency vet immediately. These situations can turn fatal within hours. Trust your instincts here. You know your cat's normal, nobody else does, and that instinct is more valuable than you realize. Being a responsible cat parent isn't about panicking over every sneeze or every nap. It's about knowing your cat's baseline and trusting that small changes deserve small investigations before they become big emergencies. Regular checkups, even when your cat seems fine, catch problems invisible from the outside. Blood work can reveal kidney or thyroid issues years before symptoms appear, and understanding that is the greatest gift you can give the cat who trusts you completely, even when it can't tell you what's wrong. If this video helped you see your cat differently today, save it, because you might need it exactly when it matters most. Share it with another cat owner, because somewhere out there, someone's cat is showing one of these signs right now, and they don't know it yet. Comment which sign surprised you most. We read every one. And if you want more honest, vet-backed content that helps you take better care of your cat, subscribe and turn on notifications, because more could genuinely save your cat's life one day.